So, menopause and perimenopause, I think honestly has upwards of about 100 symptoms associated with it.
Hmm.
So, a lot of women are also, again, kind of, they don't realize that a lot of their symptoms are from the hormonal fluctuations that happen around perimenopause and menopause. Now, perimenopause can actually last like 10 years, if you can believe it. I know. So yeah, so we can see it actually fairly early on with some women, and the range is, a pretty it's a pretty big swing for a lot of people. And then menopause is technically when you haven't had a period for 1 year. So that's when you're in actual menopause. And a lot of women like skip like 6 months and then they get a period. They're like, oh, I have to start all over
Start
again.
all over again. Yeah.
So, so what I would normally recommend, again, of course, is acupuncture and and sometimes if it's more severe, Chinese herbal medicine, like internal drinks. So, your acupuncturist, if they do herbs, they can also put together an herbal formula that will help. Yeah, and it's a drink. It tastes like dirt, but I'm actually drinking it as we speak. Um, and but it can really help just balance so many different things because I mean there's so many different symptoms like joint pain, emotional dysregulation, like you were talking about. Of course, the night sweats and hot flashes are very typical, but brain fog and there's so many different things. So even ear itchiness. I know it's like the weirdest thing, but like that's a menopause symptom. Yeah.
I'm like this, scratching my ear. I'm like, why is my ear? Oh, thank
Yeah.
you.
Isn't that
Somebody,
crazy? That's a menopause symptom. Like dry, itchy scalp. Like that's a menopause symptom. And a lot of doctors don't even tell you that either. But like so what happens in with Chinese medicine, and the reason why I just fell in love with it also is because so we don't treat menopause like, so if you come in to see us, the way I treat you for menopause or perimenopause is going to be different from everybody else that comes in because you're experiencing it the way you're experiencing it. And we diagnose you through the lens of Chinese medicine. So we look at your symptoms and then we formulate what's called a pattern diagnosis. And that's how we treat you with acupuncture and then treat you with herbs. So every single person will have different points and different herbs within their formula, even though they're going to be treated for the same Western disease, menopause.
hmm
Um, because you're experiencing it differently, your constitution is different, like everything is different.
hmm
Um, so again, if you do go for acupuncture for your migraines, I would highly recommend that you tell them also about that and your perimenopause symptoms